All right. Hello, everyone. Welcome to our Doc Talk today. My name is Dr. Mary Schroeder, and I'm here with Dr. Anastasia Stocker. And today we're going to be discussing menstrual imbalances and how to identify them and some of the underlying causes that are important to know about, and also how to treat them holistically, thinking about nutrition, herbal medicine, diet, and many different body systems. All right, a little bit about us. So again, my name is Dr. Mary Schroeder, and I'm a naturopathic doctor and acupuncturist. And I am at ARIA practicing a combination of naturopathic medicine with acupuncture and Chinese herbal medicine. And I'm really excited to be offering pelvic floor therapy at this point as well. And if you don't know what pelvic floor therapy is, we'll be talking about that later in the Doc Talk. And I also have today with me the fabulous Dr. Anastasia Stocker. She is also a naturopathic doctor and acupuncturist, and she specializes in autoimmune conditions and digestive health. And she brings at ARIA also a combination of naturopathic medicine and acupuncture and Chinese herbal medicine. So one of the things I really love about ARIA is we have a combination of Eastern and Western medicine, and we're going to be discussing both the Western medical, naturopathic, and Chinese medicine approaches and lenses for menstrual imbalances today. And I'm really excited to share those two perspectives with you.
Yeah, so as we get started today, I just want to mention that we have a lot to get through. So we're going to do our best to get through it all in the time allotted. If we go over, this lecture is being recorded and will be available online on the website later on. If you have any questions, feel free to pop them in the chat box and we'll do our best to answer them throughout the talk, or have a little time at the end to discuss things. Yeah, I'm really excited to also be here with Dr. Schroeder. She's an amazing doctor that specializes in female health and digestive health and everything that encompasses. So today we're going to just be hitting a few topics. We're going to try to recognize hormone and menstrual imbalances and how to evaluate any menstrual irregularities. And then we're going to bring it home with some ways that we can help balance these hormones and start healing some pelvic pain. Okay, so we're going to just do a brief review of female reproductive anatomy. This is the inside anatomy. So what we're not seeing here is kind of the external genitalia, but what we have here is we have the ovaries. Those are like those little almond-sized glands that produce our sex hormones, so estrogen and progesterone. Once you ovulate, the egg will go through the fallopian tube and float down into the uterus. And this uterus is lined by endometrial lining, which changes throughout your cycle, and that is then sloughed off during your period. In the middle here is the cervical os in your cervix, and that's that the bottom part of the uterus that kind of changes throughout the cycle, but for the most part feels like the tip of your nose. And then we have the vagina, and then like I mentioned before, you have that external genitalia that includes your clitoris and the labia majora minora. Okay, and then we're going to briefly talk about the axis that regulates the hormones. This is called the hypothalamic pituitary gonad axis, which is definitely a mouthful. Just talking about this axis that goes from the brain and the hypothalamus, which releases gonadotropin releasing hormone, which goes to the I always say that, anterior pituitary, or I always said in school, pituitary. And this pituitary gland is what hangs right below the hypothalamus, which is in response to that gonadotropin releasing hormone. And it's responsible for releasing LH, which will go down to the ovaries to release progesterone, and FSH, which will go to the ovaries and tell it to produce estradiol as the main estrogen hormone. These hormones then will do a feedback loop, and when the sex hormones are very high, they go and they talk to the pituitary gland and the hypothalamus to say, we don't need any more of these hormones, so stop releasing these hormones that tell me to make more. And it's a feedback loop that will produce either more or less hormones throughout our cycle.
Okay, so next I'm gonna do a brief introduction to the menstrual cycle and what happens throughout the month. So first we'll start with the follicular phase. That's the first half of the menstrual cycle that you can see on the right hand side here. And what happens during this phase is it starts with menstruation. So day 0 is when you start menstruating. And at that time, you're releasing the lining of the endometrium. So that is a fancy term for the lining of the uterus that is inside the uterus. And so what happens is an ovarian follicle starts to develop. And this you can see with this kind of enlarging circular cell here, or conglomeration of cells. And as it develops, it releases estrogen. Estrogen, when it comes to the menstrual cycle, is responsible for building the endometrial lining. So I like to think of estrogen and progesterone as kind of the bricks and mortar. So estrogen is like the bricks where you're building the endometrial lining. And then progesterone, which we'll talk about in a minute, is the mortar. So it keeps the lining in place. So here we have the ovarian follicle developing, releasing estrogen, and then around day 15 or whenever it is in your cycle that you ovulate, ovulation will occur, and this follicle will release an egg. That causes the estrogen to decline pretty rapidly. And then we have the formation of this scar tissue called the corpus luteum. And that is the ovarian follicle without the egg. And at that point, the corpus luteum will start releasing progesterone. And again, so progesterone will come in the second half of the cycle and rise throughout the luteal phase. And at that point, it's creating a nice nest for if there is any implantation and any fertilization of this egg that was released. It creates a nice nest for it to land. And it holds all of the uterine lining in place and prevents bleeding. And then at the very end of the luteal phase, progesterone tanks quickly in addition to estrogen, and that leads to us getting a period or shedding our endometrial lining. So the menstrual cycle can be considered the 5th vital sign because your length of your cycle, the heaviness of your bleeding, whether or not you have PMS or cramping, and the consistency of your menstrual blood all are all sort of signals to what's going on in your body, what's going on with your hormones, what's going on with your physiology. So it's really helpful as doctors for us to hear these pieces of information. So within a normal menstrual cycle, we shed about 2/3 of tablespoons of blood. So that's about 2 full menstrual cups or 9 soaked regular tampons or 9 soaked pads. And that gives us a sense of whether or not we are bleeding a very small amount or if we're bleeding a very large amount. This is kind of like an average that you can picture in your head. So a typical cycle is anywhere from 21 to 35 days. There's a lot more variability in that that's considered normal beyond the 28-day cycle that you always hear about. And a typical bleeding length is between 2 to 7 days, and that's all considered normal. So next, I'm just going to introduce this thing we call the hormone cascade. So we have the major hormones that we're interested in that kind of have the effect on our organs are estrogen, progesterone, and testosterone. And we'll talk about their role in the body in a minute. But first, I just want to show you this hormone cascade that starts with cholesterol. And from cholesterol, pregnenolone is formed. And pregnenolone is a hormone that gives rise to all of these other hormones. You can see it will eventually form cortisol, aldosterone, and these are hormones that have very different effects on the body from our sex steroid hormones. And then there's also this piece where it can come down and form DHEA and then go on to form testosterone and estrogen. So just to kind of keep in mind, all of these hormones are interconnected, and we're going to discuss the relationship between some of these stress hormones with our sex steroid hormones in a bit here. So estrogen is one of our primary female associated sex hormones. It's made primarily in the ovaries and then by fat cells after menopause. And it promotes the growth of the uterine lining that we discussed earlier. And it is involved in many different body systems. So it's by no means just involved in the reproductive system. It helps promote bone density. It's involved in our cardiovascular health and energy metabolism and brain health. So it has wide-ranging effects in our body. Progesterone, again, is mainly produced by that scar tissue after the ovarian follicle releases an egg called the corpus luteum. And it slows the growth of the uterine lining and prevents uterine cramping. So again, it keeps the uterine lining in place, getting ready for implantation if that occurs in the cycle. And then once it drops, the uterine lining sheds at the end of the second phase. We also have testosterone. Generally, we think of this as a male hormone, but it plays a huge role in female physiology as well. And it is responsible largely for our muscle and bone mass development and maintenance, and also plays a huge role in our energy and sex drive. Okay, so estrogen, as I was saying, has wide-ranging effects in our bodies. When it comes to estrogen, we really want to make sure that it is not too low or too high, because while it has these beneficial effects like cardiovascular protection and all of these things that we want, it can also cause problems when it's in really high amounts and overdeveloping our breast tissue and endometrial lining, or overgrowing our breasts and uterus. And this can make us more predisposed to some of the conditions we're going to talk about in a minute, in addition to estrogen responsive cancers. So when we're thinking about estrogen metabolism, we want to keep it in an even level in the body and be able to excrete it and get rid of it when it's in high amounts. So just going through the life cycle of estrogen in our bodies, again, we'll start with the ovarian release and also release from fat cells. And that will bring us into the bloodstream, where it goes to our liver. And from our liver, within our liver, it can be converted into a number of different types of estrogen. Some are more protective against estrogen responsive cancers, and some are kind of more dangerous in relationship to estrogen responsive cancers. So this is a piece we're going to discuss later on when we talk about supplementation. So just know that there's more, there's sort of better and worse forms of estrogen, for lack of a better term. And then the estrogen will go from the liver and be excreted into the bile, which is released into our intestines. And at this point, the health of our intestines, the health of our microbiome, how much fiber we're eating, how quickly our intestines are able to move our stool through, plays a huge role in whether or not estrogen is sent out in our stool or recirculated back into our bloodstream. So we're going to discuss that a bit more later as well. But there's this process by which we can either conjugate estrogen and send it out in our stool, or deconjugate it and send it back in our bloodstream. And so fiber and a number of other things are going to help us move it through in our stool. So looking at this, you can understand that estrogen is involved in many different body systems, not just the reproductive organs. And we want to think about all of these body systems when we're treating these estrogen related conditions. All right, so next we're going to go into the physiology of menstrual cramps. So the majority, or about half of the human population experiences menstrual cramps. And so what causes it? So when we enter the end of the second phase of the cycle, the end of the luteal phase, we see progesterone declines, and this causes the breakdown of cells of our endometrium. And this sudden death of all of these cells causes a release of inflammatory prostaglandins. That's a fancy word for inflammatory messengers that get our immune system going. This causes blood cell constriction, uterine contraction, and decreased oxygen to the uterus. And this can increase nerve sensitivity. So all of this combined with the cramping is what causes that pain response. And as we discuss the ways to address menstrual cramps with supplements and herbs and all of these great things later on, you can keep in mind that what's involved in menstrual cramping is decreased oxygen, decreased blood flow, and increased nerve sensitivity. So we want to address the nervous system, and an inflammatory response. So we want to decrease inflammation.
Okay, so we, as Dr. Schroeder mentioned, are both Chinese medicine practitioners. So we want to bring in the role of Chinese medicine in menstrual imbalances. So I'm just going to briefly talk about traditional Chinese medicine. It was developed over 5,000 years ago, and it was a way to explain normal human physiology. There's a couple different trains of thought. There is qi and blood ways of thinking about Chinese medicine. There's the yin and yang theory, and then there's also the Chinese organ system. And so each of these things are just different ways to explain how our physiology works. When we think about qi and blood, qi is kind of this amorphous way that we talk about the energy of the human body. It is both tangible and intangible. It is the vital substance that constitutes the human body and gives rise to all our normal activities. And then blood is formed by qi, by body fluids like water, in the essence that is what has been given to us by our parents, our genetics, and it provides the substance for all the bodily activities, including mental functioning. So it's really interesting. Qi and blood are interconnected. Qi flows through the blood, and blood is created by qi. There's also the Chinese organ system, which doesn't necessarily translate to our Western medicine thinking about organs, but they're responsible for different physiology and also for the flow of qi through the different meridians. So some of the major ones when we're thinking about menstrual balance is the liver, which is responsible for that free flow of qi. It's making sure that it can move freely throughout all of the meridians. It's also important for the storage of blood at night. When we're sleeping, blood tends to return to the liver for storage, and during the day, it can flow out of the liver and be used for all of our bodily activities. Our spleen, which when we think about the spleen, we're really talking about the digestive system, and it's responsible for the production of blood by the assimilation of nutrients for normal digestion. And that's going to be important for that regulation of estrogen that Dr. Schroeder was just talking about, and for the metabolism of fluids. We also have to think about the uterus, which is an extraordinary organ which produces menses and pregnancy. It's also the origin point for 4 extra meridians. We're not going to go into too much today, but which is really important for normal female physiology. So when we think about menstrual imbalances, there are some major patterns that we normally see. Number one being that blood deficiency. We don't have enough of that material foundation to fulfill the normal physiology that we need. There's also blood stagnation. So this can occur for a variety of reasons, one being trauma, like a contusion, a bruise, you think like that, that is blood stagnation. There's also other reasons like blood deficiency leading to blood stagnation, which can occur, which can lead us into different pathologies that we're going to briefly mention very soon. Spleen Qi Deficiency, any problems with our digestion can lead to Spleen Qi Deficiency and it not being able to do its normal function. And then liver Qi stagnation. This is one of the major causes of some menstrual imbalances and changes that occur, leading to mood changes, depression, anxiety, that type of thing. And the stagnation of liver qi allows us, or doesn't allow us to have that free flowing and normal physiology. Okay, so some things we're going to cover today are the causes of menstrual imbalances, including endometriosis, PCOS, fibroids, some stress, PMS and PMDD, and anemia, and some of the signs that we can have with that. So we'll get started.
Okay, so first thing we'll discuss is endometriosis as one of the major causes of pelvic pain in people with periods. So it's really shocking that an estimated 10% of people with periods are have endometriosis, and yet very few of us know what it is. And also it's shocking that it takes an average of 10 years for people to receive a diagnosis. So what is endometriosis? It is a condition that is caused by the tissue from the uterine lining growing outside of the uterus. So if you can imagine these kind of blood vessel cells that respond to estrogen, they seed in different parts of the body. So on the right here, you can see in between the intestines and the uterus. Sometimes they can be on the bladder, sometimes they can be on the diaphragm. It can really be all over the pelvic cavity and in distant sites. And what will happen with endometriosis is when these lesions, these seeds of endometrial tissue, will respond to estrogen stimulation every month, just like the lining of the uterus does, and grow. And then it'll bleed into the tissues around the uterus. So it can bleed into kind of the area between the intestines and the uterus, or between the uterus and the bladder. And this causes a lot of pain. The body will see this bleeding in these cells and say, what is this? We need to heal this, as if it's a wound. And that causes further inflammation. And one of the things that can happen is the bleeding and the mass of these tissues can impinge on nerves in the pelvic cavity. So this can cause pretty severe pain with periods, often causing people to miss work and miss out on life activities. And other symptoms depend on location. So you can have pain with urination or defecation or changes in your bowel movements around your menstrual cycle if it's located on those areas. So if it's located on the bladder, you'll more likely have urination issues. And if it's located on the intestines, you'll more likely have more like constipation and diarrhea. We will sometimes see heavy bleeding in folks with endometriosis, and often things like nausea and vomiting and fatigue because of this kind of systemic inflammatory response that it causes. And often we'll see infertility as one of the main things that will tip people off that they need to come see a provider. All right, next we also have uterine fibroids. So these are very common. They affect 20 to 30% of people with periods. And they are solid masses of fibrous and muscular tissue that can grow in and around the uterine cavity. They can be small, from like a quarter size to a basketball size. So sometimes they can cause significant masses in the abdomen and displace other organs. So they can interfere with the uterus anatomy and block and affect our physiology and the organs surrounding the uterus. And often with fibroids, we'll see severe cramping, heavy bleeding with menses that can lead to anemia. So too much iron loss each month, which can then exacerbate bleeding because anemia will slow bleeding. Or I'm sorry, iron will slow bleeding. So when we're losing iron, that can make us bleed even more strongly. And then sometimes you'll see an abdominal mass form with uterine fibroids when they get big enough. So the diagnosis with this is often made through a transvaginal ultrasound and from symptoms. All right, so when it comes to traditional Chinese medicine, I just kind of want to bring those theories that Dr. Stocker was talking about back into context here. So blood stagnation is a big deal when it comes to period pain in traditional Chinese medicine. And this is often present when someone comes in with endometriosis and fibroids. Blood stagnation is often used to describe things like masses, tumors, and blood clots. And it's associated with the sensation of a stabbing pain. So kind of more intense, painful presentations. And so the goal within a traditional Chinese medicine context in treating uterine fibroids and endometriosis would be to move qi and blood with acupuncture and Chinese herbs. And we'll discuss more on that later.
Okay, so PCOS or polycystic ovarian syndrome is the most common endocrine disorder in women. The signs and symptoms are often very variable from person to person that's experiencing PCOS. This is because it's a syndrome, it's a conglomerate of symptoms, but the most common are those irregular or missed periods. You often have really high testosterone, and this can lead to abnormal hair growth, so growth on the upper lip, around the jaw, on the back. It can lead to the loss of hair in this male pattern balding. So here on the top of the head, it can also lead to some pretty severe acne. Oftentimes, multiple cysts can be seen on imaging, and this may lead to some pain with your menstrual cycle. We often see disturbances in insulin metabolism, so leading to blood sugar dysregulation. So usually we see an increase in blood sugar, and then this can lead to things like diabetes and other metabolic problems. Okay, PMS. PMS is one of the most common causes or symptoms of menstrual imbalances. Most patients with female anatomy will have PMS of some sort at some time in their life. It's often worse right during that perimenopause time of life, which is that time period when your hormones are shifting and slowing down when you're about to go through that transition of menopause. So the PMS is most common in late 20s and early 40s. There's multiple subtypes of PMS, so everyone could experience this a little bit different. There's PMS-A, which is for anxiety, PMS-C, which leads to cravings, PMS-D or depression, hydration, which when we think about hydration, we're thinking about that water retention. So bloating, breast distension, and breast pain in that other category that kind of encompasses all other symptoms that we talk about with PMS, things like acne. There's no real known cause for PMS. There's many theories, some of them being a hormone and neurotransmitter imbalance. And so like Dr. Schroeder was talking about, usually we think about having higher levels of estrogen, lower levels of progesterone, some changes to our neurotransmitters, so things like serotonin leading to depression or anxiety. Issues with detoxification, usually we're thinking about the liver and the whole GI system, so not the inability to really get rid of that excess estrogen, which leads to changes in the ratio between estrogen and progesterone, which leads us into the dysbiosis in our GI tract, in our normal flora. When we have imbalances in those flora, we can deconjugate the estrogens like Dr. Schroeder was talking about, which leads to reabsorption of estrogen, which can change that balance, that delicate balance between estrogen and progesterone, and cause some symptoms. There's also theories around having essential fatty acid deficiency, which Dr. Schroeder briefly mentioned about the prostaglandins. And when we have lower amounts of these essential fatty acids, it leads us down this more pro-inflammatory prostaglandin pathway, which leads to pain and cramping, especially when we think about the causes of menstrual cramps. It's also the inflammatory cytokines, which are those chemical protein messengers that are telling your immune system that it needs to be activated, which can create increased inflammation and pain. And then there's also theories around oxidative and reductive dynamics. And this is really thinking about different vitamins and mineral deficiencies leading to an excessive oxidative damage, which leads to inflammation and more pain symptoms that can be experienced with PMS. Okay, so in Chinese medicine, PCOS is a mixed presentation. Each person kind of presents differently with PCOS. So it's really individualized on what their TCM diagnoses might be, but oftentimes we see a spleen Qi deficiency, and the spleen is not able to do its normal function of transporting fluids. So this leads to an excessive damp accumulation, and we commonly see that, and we can see that with the multiple cysts on the ovaries. And usually we would like to try to regulate the spleen and try to drain some of that damp. With PMS, it really depends on the subtype and the symptoms that each person may be experiencing. But most commonly, it's the liver Qi stagnation and the spleen Qi deficiency. So the liver Qi not being able to flow freely and causing changes to your mood. And the liver channel runs down the front of your body right through your breast. And so if there's liver Qi stagnation, it can lead to breast tenderness and also spleen Qi deficiency. And the spleen, like I said, is really talking about the digestive power and your digestive force. And so when you're deficient in that, it causes changes in your digestion and leads to food cravings. So we principally want to move Qi, regulate the liver, and tonify our spleen.
Okay. So we know that stress affects the majority of our body systems. And when it comes to the menstrual cycle, it's clear that acute or prolonged stress can lead to significant changes, to the extent of, it can worsen PMS. Sometimes it can completely stop the menstrual cycle altogether. So it's something we often think about from a naturopathic and a Chinese medicine perspective. So cortisol is one of our major stress hormones. It's released during by the adrenal glands during periods of stress, and again can lead to delayed periods, lighter periods, or missed periods. And I'm going to explain that with this diagram in the next slide here. So there's one hypothesis called the cortisol steal hypothesis, and this brings us back to the hormone cascade. So you can see that all of our sex steroid hormones are produced via these pathways and have common precursor molecules and hormones like cholesterol and pregnenolone. And so one of the reasons why why periods may stop during periods of extreme stress is we have this shunting of pregnenolone to progesterone, but then rather than staying as progesterone, it can be shunted into cortisol production. And that kind of shunts the cholesterol and pregnenolone away from the production of progesterone, testosterone, and estradiol, leading to lower amounts of those hormones overall. So again, stress and cortisol release, it plays a huge role in these processes. So later on, we'll talk about stress management techniques as one of our ways of addressing some of these conditions.
So I just briefly want to talk about hormones and autoimmunity. Autoimmune diseases are more prevalent in women, and this is often thought that it has to do with the levels of fluctuation of hormones that are occurring throughout our cycles. So there's hormones that are pro-inflammatory, which can lead to worsening of autoimmune disease or autoimmune disease symptoms. And there's hormones that tend to be anti-inflammatory and can improve these symptoms and the characteristics of autoimmunity. So when we're working with patients that have autoimmune disease, we're often asking lots of questions about the menstrual cycle or about their past menstrual cycle if they're not menstruating anymore. And our goal is to balance these hormones to try to help regulate the immune system. So common patterns that we see are estrogen and prolactin being high, and then some of these other anti-inflammatory hormones being low, progesterone, testosterone, cortisol, DHEAS, which is that precursor, and the thyroid can kind of swing either way. Being high or low can really affect the immune system. All right, so we're gonna talk about some ways that we can diagnose some imbalances to the menstrual cycle. And we're gonna talk just about some different ways that we can be aware of our menstrual cycles and ways that you can bring it to your healthcare practitioner and give them tools that can really help you find balance to these systems.
Okay, so one of our first go-tos for getting information about the menstrual cycle and developing awareness around it for you as the patient are these cycle awareness apps. So those include Kindara, Flow, Clue, Glow. A lot of them are free and will come with, you can buy added packages to help you analyze your cycles, but the basic ones are all you need to track your cycle length and to get an understanding of how whether or not your cycles are shifting in their length or staying the same over time. And it can be super helpful for when you go to the doctor and you are trying to remember when your last period was and how your symptoms related to the onset of your cycle. And it can also be very helpful for tracking changes in your cycle as you go through these holistic treatment strategies that we're going to discuss later. It can also be really helpful for predicting fertility, although it's not necessarily the best when it comes to predicting ovulation, because they'll kind of give you a sense of when you may be ovulating, but you have to remember that while the idea is it's typically day 15 in a 28-day cycle or in a 30-day cycle, it varies so much. So some people can ovulate on day 5, some people can ovulate on day 20. So don't rely on that for prevention or planning of pregnancy. But again, this is a very helpful tool for just being aware of your cycle. So basal body temperature tracking is another great tool we have that gives us more specific information about ovulation. So in this method, you can take your temperature every morning, and you have to, the important thing is you have to do it at the same time every morning, because changes in the time that you take it, or if you get up and move around, that can change your temperature pretty drastically. And what we're looking for when trying to track ovulation is these tiny increases in our temperature from at a 0.2 degrees. So like 0.2 of a degrees increase. So for this, you need a special basal body temperature thermometer that gives you more precise temperature measurements. And then the idea is you can track it either in an app or on a pen and paper, and it allows you to note the time that your resting body temperature goes from a lower to a slightly higher amount. So in the first half of your cycle, it's slightly lower. In the second half, it's slightly higher. And that is related to your estrogen and progesterone in those time periods. Another really interesting way to track your ovulation and fertile window is tracking your cervical mucus and cervical position. So this is another great way to just kind of get more familiar with your body and your anatomy. When it comes to cervical mucus, you can basically test, you want to get a sample of your cervical mucus very close to your cervix, and you can test its elasticity at different times in your cycle. Typically, you'll have a more dry and sticky kind of cervical mucus when from days 1 to 6 of your cycle. And then as you get closer to ovulation, this thing called ferning can happen, where up to the right here, you can see if you were to look under it under a microscope, you would see these ferning patterns, and they give the cervical mucus this greater elasticity. So it forms more of an egg shape, or an egg white type quality between your fingers if you were to kind of pull your fingers apart, and you can see it gets stretchier. So very interesting way of tracking your own fertility. And another thing that you can look at is your cervical position. So this usually involves taking a speculum and a mirror and looking at your cervix, or you can kind of feel it internally. And when someone's fertile, their cervix tends to be higher and softer, so more like the tip of your finger, and then when you're not fertile, it tends to be lower and firmer, so more like the tip of your nose. So yeah, super interesting ways to just kind of get to understand your body better.
So if you come in with some of these menstrual imbalances, there's often lots of testing we want to do to just do a really thorough assessment. So there's hormone testing, whether it's through blood or the saliva. We're also going to be checking for different conditions that can go along with menstrual imbalances. We're going to be looking at your iron levels, your blood count, your metabolic pattern, looking at your liver, kidney, and gallbladder function. We're going to check thyroid. We're going to be looking at your blood sugar and checking for any autoimmune contributions to symptoms if we think those are present. There's some imaging that sometimes needs to be done, like those transvaginal ultrasounds. And then to make that diagnosis of endometriosis, it's often a laparoscopic surgery, which involves them going in and kind of looking for those lesions outside of the uterus. Okay, so now we're finally going to get into what are some ways that we can improve our menstrual cycles and lead our way to wellness.
Okay, so first we're going to talk through some dietary strategies. Often my goals with patients is for this to be the first line because it's the most sustainable over time typically if we can get a lot of our medicine through our food. So, our dietary goals with a lot of these menstrual imbalances are to reduce inflammation. So, remember before we were saying menstrual cramps, endometriosis, and a lot of these um, conditions that involve inflammation within the pelvic cavity can really benefit from anti-inflammatory strategies. So that's one of our primary goals. Regulating blood sugar is one of our primary goals, particularly with conditions like PCOS, where we see potential um, insulin and blood sugar dysregulation. And then we also want to support our hormone metabolism. So if you think back to the estrogen metabolism I was discussing before, we're going to now dive into some ways that you can support your estrogen metabolism with certain types of foods. So one of our primary things we want to focus on is increasing healthy fats in our diet. So omega-3 fatty acids are anti-inflammatory fatty acids, and by consuming them regularly, you can load your cells with these precursors for your immune messengers that are less inflammatory than others. So omega-3 fatty acids are found in salmon, are found in sardines, flax seeds, and chia seeds. And there's many ways that you can incorporate that into your diet. And then often we're supplementing with things like fish oil or flaxseed oil to just kind of boost the intake of those omega-3 fatty acids. Eating whole organic foods is really important. Avoiding pesticides and processed salt and sugar is really helpful. Pesticides can often be endocrine mimickers and affect our hormone signaling in that way. Eating antioxidant-rich foods and vegetables. So with this, you want to think about eating the rainbow, eating dark, colorful berries, pomegranate juice, carrots, everything you see to the right here that has lots of color in it. These are largely going to contain a lot of antioxidants. And what those do is they mitigate any of the oxidative damage and stress that can come from these inflammatory events. Phytoestrogens and brassicas are two great categories of foods that I'm going to talk about in a few slides that can help with estrogen metabolism. And fiber is a big thing that can help with estrogen metabolism. So before, you might remember that we discussed the bile comes out of the liver and is sent in, and it carries the estrogens from the liver into the digestive tract. So if we want to get estrogens out, if we have too much estrogen around and we want to keep it from recirculating, fiber is going to help us kind of bind all of those estrogens and send them out in the stool. So you can increase fiber by just having every meal covered in vegetables, covering your plate with at least 50% vegetables. That would be the goal. So next, we want to avoid foods that increase arachidonic acid, such as red meat and fried and processed foods. Arachidonic acid is a pro-inflammatory fatty acid that is a precursor to a more inflammatory immune response. And we also typically want to decrease alcohol in our system. That's going to allow our liver to process our hormones more efficiently. And we also want to decrease caffeine, particularly when we're having bad menstrual cramps. So I'll let you look through this at your own leisure. This is just some healthy sources of fats and ideas for vegetable and animal sources of fats. So our next major food group, if you will, that we want to talk about is phytoestrogens. So these are estrogen mimicking constituents in plants. Some of their some of the major groups of phytoestrogens are called lignans and isoflavonoids, and they exert a mild estrogenic effect in the body. So if you can imagine in a menstrual cycle where someone has really high estrogen in the beginning of their cycle and then it drops off later, that's going to affect your mood in ways that are generally undesirable and can lead to overdevelopment of your breast and endometrial tissue. And so what we want to do with these phytoestrogens by consuming them regularly is kind of even out that estrogen, that estrogenic effect throughout the month. And so you can think of phytoestrogens as a key that goes into a lock, and that's the estrogen receptor. And rather than opening the door all the way like the estradiol in our system does, these phytoestrogens open the door a quarter of the way or half of the way. So it has a less strong effect. So they're found in things like soy. So you can, get that in tempeh, tofu, and soybeans, flax seeds, sesame seeds, and certain herbs like licorice, hops, and red clover. So our next major food group is the brassicas. So this contains many vegetables that are actually all the same species. And they contain cabbage, broccoli, cauliflower, Brussels sprouts, bok choy, I think I already said cabbage. A lot of these different really healthy vegetables, and they contain diindolylmethane. methane. And diindolylmethane methane is known to support estrogen metabolism to produce estrogens that are less dangerous to our system in terms of those estrogen supported or estrogen responsive cancers. So these molecules are going to protect us from estrogen responsive cancers like breast cancer and endometrial cancer, and generally seem to promote a healthier balance of estrogens in our system. They also contain sulfourathane, which are very strong antioxidants that again are protective against breast cancer. So these are great when you have estrogen dominance and are trying to find ways to decrease estrogen in your system, or make sure you have the right types of estrogens in your bloodstream.
Okay, so as you know, estrogens are these estrogen-like molecules that can tightly bind that estrogen receptor and can more strongly cause an estrogen-like effect. These are often found in plastics. And so they can increase the risk of endometriosis or other estrogen-responsive conditions. So we want to do our best to avoid those in our environment. And ways we can do that are doing things, Laura mentioned on the next slide, they're doing things like using glass containers and not reheating foods in plastics, not putting hot foods in plastic, because when we do that, it kind of leaches those, estrogens into the food from the plastic. It's using products that don't have phthalates in them. So using resources like the EWG and researching healthy products to put on our skin, because these things can be absorbed through our skin, and sweating. And we'll mention that briefly when we talk about exercise, but sweating through exercise and sauna use can help us rid these estrogens through releasing the molecules through our skin. Yeah, I talked about that a little bit. Okay, exercise, great. So it's a balance. We want to make sure we're doing a moderate amount of exercise. Like Dr. Schroeder talked about on that slide about menstrual cramps, we want to try to bring movement in the days prior to our a period to try to bring increased oxygen flow to those pelvic organs so we can try to prevent cramping. If you were to have PCOS, we want to increase the amount of exercise. So really aiming for upwards of 60 minutes per day of aerobic exercise, so really moving your heart, and 20 minutes of that strength training to increase the muscle mass. Also doing a little bit of movement after you eat for about 10 minutes, just like going for a brief walk or just moving around, will help bring glucose or blood sugar into your muscles and try to kind of even out any spikes in blood sugar that can occur.
So before we were talking about the impacts of stress and cortisol and the cortisol steal on our hormones and our menstrual cycles. So there's so many ways to support ourselves in mitigating stress and managing stress. And, you likely have one or two strategies that you've utilized in the past. And I often encourage patients to really develop whatever strategies have already worked for you. Some of the ones that we often discuss are progressive muscle relaxation, diaphragmatic breathing. So this is a breathing where you're breathing deep into your belly, and if you can visualize each time you take a breath in, you're sending your diaphragm down. That is going to kind of compress your pelvic organs and is really helpful actually for bringing blood flow and kind of flushing your digestive system and pelvic organs, and is a way of bringing movement and kind of a gentle massage each time you take a deep breath. So that can be really helpful when you're having stress related menstrual issues. Um, so we also have yoga and Tai Chi meditation. And I also remind folks about the importance of community and engaging with your community and laughter, doing things like exercise and sex and massage to help release the natural opioids in your system. So, all of these things are things to just, the goal is to incorporate these more or less on a daily basis and just kind of have a regular routine with them to kind of get ahead of stress. So next we're going to talk about herbal medicine and the many ways we can use herbal medicine to treat menstrual imbalances. And as we discussed earlier, when it comes to menstrual cramps or, many of these different conditions, there's so many different organs involved that we want to think about this from many different body systems. So the first category of herbs are smooth muscle relaxation and antispasmodics. So as we were discussing before, one of the major causes of period pain is that cramping of smooth muscle in the uterus. And some herbs that can be really helpful in slowing that cramping include wild yam, valerian, and cramp bark. We also want to think about decreasing the inflammatory response within the uterus and the pelvic cavity. So I'll often have my patients start these in the week leading up to menses or even 2 weeks before menses. And these can include ginger, turmeric, and willow bark. Ginger and turmeric are really great at bringing blood flow to around the body and also to the pelvic organs. That is important again because that decreased oxygenation is one of the ways that we can develop intense period cramps. And then willow bark is a great anti-inflammatory herb. It is actually so salicylic acid is the active ingredient in aspirin, and that was originally derived from willow. So that's a kind of gentle way of supporting of reducing inflammation and relieving pain. And then we also have herbs for hormone regulation. So these include chaste tree berry, which I'll get into in the next slide. This is one of our primary herbs for managing menstrual cycles and managing hormones, helping regulate hormones. And then we've got maca. This is a great herb for the follicular phase for supporting your estrogen reserves, particularly when someone has low estrogen that's affecting their cycle. And then saw palmetto is another great herb that inhibits the production of a stronger testosterone form. And this is really helpful in PCOS because high testosterone is one of the main criteria and concerns in PCOS that leads to acne and many of the other complaints that people have with that. All right, so next, when it comes to mood support, this is a big one for people who have PMS and often can have more significant presentations like premenstrual dysphoric disorder. And we really want to think about including herbs to help relieve tension and support your serotonin levels. So passion flower is great as a nervine for relieving tension and anxiety, and St. John's wort is great. It has it's been shown to increase to support our serotonin pathways and is really great for very mild depression. We also want to think about, and just a quick aside with St. John's wort, be very careful with it if you're on any kind of pharmaceutical because it can impact your metabolism of those. We also want to think about liver support. So these include herbs like milk thistle, Oregon grape, and dandelion, and these are all going to support our liver in metabolizing our hormones in an efficient and even way. So when it comes to chaste tree berry, I love this herb because it is very effective for many types of hormone imbalances. And we're often using it when there's a picture that suggests higher estrogen and lower progesterone throughout someone's cycle. And this herb has been very well studied. There's a lot of research on it. And what they've found is that it mainly acts by regulating prolactin levels. Prolactin is a hormone that's secreted from your pituitary gland, and it can affect the release of progesterone. It can decrease the release of progesterone. And it is also involved, prolactin itself is associated with breast tenderness prior to menses. And chaste tree is particularly good at relieving breast tenderness and then regulating the menstrual cycle by enhancing our progesterone release in the second half of the cycle. So yeah, amazing herb. We use it a lot. Next, Dr. Stocker is going to talk about traditional Chinese medicine herbs for menstrual irregularities.
So Chinese medicine, herbal medicine has been extensively studied for the use for different disorders. A lot of these herbs are really interesting because they've been studied in the biomedical model and they have been shown to affect hormones. And then they also have their traditional Chinese medicine usage. So a few of them, some of our favorites, white peony really helps modulate estrogen, prolactin, and reduce androgen levels. So we're thinking about testosterone there. And then Chinese medicine, it helps to tonify or nourish blood, and it preserves the yin or our bodily fluids. Dongui or angelica is a really great herb because it both tonifies and increases blood and also moves blood. So for that blood stagnation picture that we talked about. And then Chai Hu, or Bluerum, which is one of my absolute favorite herbs, it affects the liver. It's anti-inflammatory. It protects your liver. So if you're having any elevated liver enzymes or conditions that would cause your liver to just be a little sluggish, Chai Hu is a really great herb. And it's used to spread that liver qi and help relieve any stagnation. We're also going to just talk about briefly some formulas. So Chinese medicine, we're often using formulas and then making modifications depending on each person's picture. So a couple of them are listed here. The first one being Si Wu Tong, or 4-substance decoction. This is just our base foundation for tonifying or nourishing blood. It's also really important for regulating our liver and improving circulation and regulating the menstrual cycle. Gui Jir Fu Ling Wan, or the cinnamon emporia pills, is really important for those blood stagnation pictures. So the endometriosis, PCOS, things like that. Gui Pi Tong, or Restore the Spleen decoction, is really important for tonifying our spleen qi. Therefore, it's going to nourish blood. It's going to also have effect on the Chinese medicine heart, which gives us symptoms like anxiety or difficulty sleeping. So when we can nourish our heart in Chinese medicine, we kind of have improved symptoms. And then Xiao Yao San, which is used all the time, rambling powder. It's our #1 go-to for regulating our liver. It spreads the liver qi. It helps strengthen our spleen, and it does a really great of harmonizing the two organs when they're both just like a little imbalanced. So helping the liver to support the spleen.
Okay, so next I'm going to talk through some supplements that we can use for estrogen metabolism, reducing endometrial inflammation, PMS support, and liver and detox support. So this is coming back to that estrogen metabolism slide that we mentioned in the beginning. And now I'm just going to explain how some of these supplements that we like to use for estrogen metabolism are coming into play. So before, I was mentioning that in the liver, there's a couple of different estrogens that can be produced, and some are more protective and some are more what we could say proliferative to breast and endometrial tissue that can predispose you more to estrogen responsive cancers. So when it comes to promoting the production of healthy estrogens, diindolylmethane methane can be really useful. So as I mentioned, it is extracted from the brassica vegetables, so cabbage, kale, cauliflower, broccoli, all of those, and we can create these supplement extracts to get it in higher amounts. So we'll often supplement with that to promote your healthy estrogen metabolism. We also want to think about the phase where it's in the intestines, and we want to send estrogen out through the stool rather than allowing it to recirculate into our bloodstream. And at that stage, supplements like calcium D-glucarate come into play. They inhibit beta glucuronidase, which is the enzyme that deconjugates estrogen from the stool, from the bile. And so calcium D-glucarate helps us excrete it in the stool, helps us excrete estrogen in the stool, and thereby lowering our levels overall. And then before, I mentioned the importance of fiber for also binding that bile and binding estrogen and taking it out of circulation. And that is another thing you can get in supplement form if you're having a hard time getting it in high enough amounts in your food.
So some anti-inflammatory supplements that are going to try to reduce that endometrial inflammation. We have resveratrol, which is a polyphenol that's found in the skin of grapes and berries. It's also was originally found in wine, and it helps to regulate those inflammatory cytokines or chemical messengers that we were talking about earlier. We also have pycnogenol, which is found in pine bark, and it also blocks these inflammatory markers, immune system markers. So NF kappa beta and TNF alpha, it blocks the activation of these proteins that lead to an inflammatory response. And then also, Dr. Schroeder already mentioned these, the omega fatty acids. So we can supplement these as well as include them in our diet to be more anti-inflammatory versus pro-inflammatory. Okay, and then there's some supplements that are going to help with PMS and mainly the mood. So 5-HTP is the precursor for serotonin, and we can take this supplementally, and it'll help encourage the production of more serotonin, which can improve mood. B vitamins are really, really important for a whole variety of things. They're essential nutrients for that first phase of the liver detoxification. So there's two phases of liver detoxification, and B vitamins are really important in that first phase. And then Dr. Schroeder already kind of talked about the second phase going through the digestive system. B vitamins are really important for energy production and for the production of blood cells, so making more red blood cells, and for neurotransmitter production. They're involved in hundreds of biochemical events that are happening in our body. Liver and detox support. So that's going back to talking about that healthy hormone metabolism and being anti-inflammatory. NAC or N-acetylcysteine is a precursor for glutathione that you see there listed. And this is the major enzyme in your liver that is metabolizing most hormones, chemicals, everything that your liver is detoxifying, which is everything that is being filtered in your blood. And then Dr. Schroeder already talked about fiber for that detox support and getting rid of excess estrogen.
Okay, so next I'm going to briefly discuss hormones and birth control, and how we can, supplement hormones for these menstrual conditions. So first off, I just want to mention that contraception is an incredibly important end goal in itself. If either getting pregnant or not getting pregnant is your goal, we want that to be primary in kind of making decisions surrounding your hormone balance. And it's individual for everyone. When it comes to choosing a contraceptive, it really depends on the person and your hormone balance, your ratio of estrogen to progesterone that you produce, and then what your goals are. So it's very individualized. But when it comes to treating these conditions we're mentioning, I'm going to discuss that sort of aside from the goal of preventing pregnancy. So oral contraceptives are often used for conditions to stop your menstrual cycle. So if you're having serious pain with your periods, with endometriosis, if you're having really bad acne and hair growth and changes that you're not wanting with PCOS, oral contraceptives combined or progesterone alone can be really helpful in stopping your hormone cycling and suppressing that whole menstrual cycle that I was describing before to get rid of your symptoms. So that can be a really useful tool. The downside is that generally symptoms will return with discontinuation of those oral contraceptives, And if you're pursuing pregnancy, then they're not useful, obviously, because they'll prevent your pregnancy. Um, so when we are choosing oral contraceptives, I often recommend the lower dose versions. So low estrogen, or the progesterone only pill or the mini pill offer these really small amounts of hormones that are much lower doses than the original birth control hormones were, and they can have less side effects or less of the undesired side effects that we see with the sort of original birth control forms. When it comes to endometriosis and fibroids, the progesterone IUD is one of our main tools. And especially if someone's not wanting to get pregnant, it can be a really great option because it's providing that progesterone support right at the endometrium where you want it. So the IUD is a device that's inserted into the cervix and stays there and slowly releases, when it's the progesterone IUD, it's slowly releasing progesterone. And this is particularly helpful for things like endometriosis and fibroids because, as we were discussing, progesterone can stop the growth of the endometrial lining and prevent bleeding. So very, very useful if someone's life is debilitated with endometriosis. There's also the option of transdermal progesterone. This is not useful for birth control because it's less predictable than oral or the IUD form of progesterone, but it can play some really great roles when, for instance, we want to gently boost someone's progesterone level if they're having, for instance, autoimmune issues related to low progesterone and elevated estrogen. So there are ways that we can use the transdermal progesterone to support estrogen levels. We just don't use it in the form of birth control. So lastly, I will talk through uterine massage and almost lastly, we have one more after that, but we've got uterine massage and pelvic floor therapy. So I'm really excited to be offering this at ARIA. It's a really amazing tool for pelvic pain, urinary issues, bladder, vaginal prolapse. And it generally involves a gentle body work for your pelvic organs. That's an abdominal massage. And this can be really great for enhancing blood flow to the pelvic organs and can be really helpful for the digestive system. And then it often also involves intravaginal trigger point release for muscles that are tense within the pelvic floor. So the pelvic floor is a hammock of muscles that exist below the pelvic organs and between the pelvic bones. And after childbirth or after long periods of painful menses or any trauma to the pelvic area, we can have either tightness develop that can cause pain and discomfort, or we can have too much kind of give and laxity that can lead to things like bladder and vaginal prolapse and urinary incontinence. So the goal of pelvic floor therapy is to release tension if that's causing problems, or to support you in building strength if that's what you need. So as it relates to these conditions we were discussing, it's often used after a pelvic surgery to release adhesion. So for instance, if you've had endometriosis and had a laparoscopic surgery, sometimes you'll have leftover scar tissue that we can help resolve with pelvic floor therapy. So really great tool that I'm excited to be doing at ARIA now.
And then finally, acupuncture and traditional Chinese medicine, diet and lifestyle, some considerations. So acupuncture can be really great for pain management and symptoms related to different disorders It can help with those adhesions that Dr. Schroeder was talking about too, if they're in the abdominal cavity, or anytime like if there's a scar tissue like from a cesarean section, acupuncture can help with pain with that, along with the pelvic floor work. There's also some diet and lifestyle. So it's this keep thinking of keeping the uterus warm, which is kind of an interesting topic. When cold gets into the uterus, so if you like are menstruating and you take a cold plunge like into the ocean, your uterus can get cold, and this cold kind of constriction. It can cause a lot of pain and cramping. So we want to try to keep your uterus warm, applying heat when you're menstruating, eating warm cooked foods that are really easy to digest during that time period, keeping a variety of colors and vegetables to increase that antioxidant and polyphenols in your diet, and then that consistent, moderate exercise, not too much, not too little. It's all about balance. And really, traditional Chinese medicine really boils down to how we can maintain balance in our life. And using all these different avenues really kind of brings that all together. So acupuncture, diet, lifestyle, supplements if we need it, taking time for yourself for that stress reduction, and having good community bonds like Dr. Schroeder was talking about is really what Chinese medicine boils down to, and why it's so important to include when we think about these menstrual imbalances. Okay, so thanks for sticking with us. It was really great to talk about this. I hope everyone agrees. If you want more information or if you have any questions, feel free to send us a message, and stay tuned. We're going to have more talks coming up in the future over the summer. So keep a lookout for that. Yeah, I was really happy to be here with Dr. Schroeder. I hope you guys all enjoyed this talk.